Hello everyone, my name is Dr. Aditya Gupta. In this video, I'll be talking about how do you, what study strategy or what plan you can use in order to be able to crack your NEET PG or INICET that is scheduled for your in the month of May in the next 3 months, and how should you go about it. So I'll first begin with what exactly PG entrances want from you. See, PG entrance is not about how much knowledge do you have. In fact, no entrance exam is actually anytime about how much knowledge do you have. It's actually about the fact how much knowledge you are able to retain and able to sort of vomit out. It might sound wrong, but that's the truth about the examination. Your rank will be determined not by how much hard work you do, but how much you actually remember on the day of the exam, especially as far as postgraduate entrance examination is concerned. I mean, let's take examples of subjects which are particularly volatile, be it anatomy, be it ophthalmology, be it pharmacology. If you do not revise them during the last 7 days or last 10 days, even the easiest questions that are asked from these topics, and there will be obviously some questions which will be asked from anatomy or pharmacology or ophthalmology, you will mark them wrong, and every marking wrong or every easy question left which other person attempts will result in a lower rank. So our strategy in INICET or NEET PG in the last 3 months is to make sure that you are able to do maximum number of revisions. What most people follow and what you should try to follow is try to get at least 3 revisions before the exam in these 3 months. Not one month revision. Try to do them in a way so that the revision time gets shortened every time you try revising again. So first, get one revision done in next 2 months. You can plan it in a way that 30 days are given for major subjects and 30 days are given for minor subjects. Then another revision in 1 month, and then one final revision in the last 1 week. So let's assume today, right now, it is February 25th. Yeah. So if February 25th, you plan your revision in such a way that let's say by April 20th, you are able to do first revision. From April to May 20th, you are able to do second revision, and in the 1 week before the exam, you are able to do the third revision. Even if you're not able to follow this, you should at least have a plan that you're able to do one revision in around 2 months and another revision in 15 days or something like that. If you're able to stick to this plan and able to revise the subjects in small amount of time and then essentially vomit it out, it will ensure that you get a good rank. Now, how do we revise in such a way? This is the time why your handwritten notes are important, and I keep on emphasizing upon the importance of notes. It's only on your notes. See, you cannot revise a book. You cannot, even if I know that I've read Robbins thoroughly, or I've read my Genong thoroughly, or I've read my Harper thoroughly, or I've read my Harrison thoroughly. Do you think I can revise the entire medicine in, let's say, 1 day by going through Harrison? No, it's impossible. The important thing that you have to remember is that you can only revise through things which are concise. You should not delve into the vastness of it or the depth of it. You just try to cover whatever it is and revise it. That's why your own handwritten notes become important, and that's why I keep on emphasizing the importance of first aid. Do I have my first aid with me? Just give me a moment. I've talked about first aid multiple times. You can check out my previous video about what first aid is. Just give me a moment, I'll get my first aid. Yeah, I'm so sorry. So this is the book I was talking about. This is First Aid. So First Aid as a book is basically, what is it? First Aid is basically made for USMLE Step 1. It contains all your first prof and second prof knowledge concise in a book. You cannot revise Harper, you cannot revise Genong, but this is one book. This is like this thick. This has around 640 pages, out of which 100 pages are not required because there are ethics or something on those lines. So 500 pages which you can actually revise in last 1 week. Even if you're doing, like, let's say, you're studying for, let's say, 8 to 10 hours in a day, and you're just doing 10 pages in an hour, even then you can revise this entire book, and this for first and second prof entirely. You can revise this entire book in 5 days, and then you can cover this covers your first and second prof along with psychiatry and biostatistics in a major way. So 50% of syllabus is covered with just these 500 to 600 pages. That's why I keep on emphasizing upon the importance of first aid. Not just me, you would have seen Zenab also emphasize upon the importance of first aid. And for that matter, any IIMSonian, this is something which we do start doing using from our internship beginning. I made the mistake, let me tell you, I started a bit late. But having said that, I did not start a bit late. If you're going to ask me, can you start it just now? Yes, you can. If you're 3 months before the exam and you're revising pathology, pharmacology, physiology, biochemistry at this point of time, make sure that if you're revising it from your notes, or you're doing previous year questions, or you're solving a Q bank, then at the same point of time, you put everything together consolidated into the first aid. So that for the final revision in the 1 month, 1 week before the exam or 2 weeks before the exam, you use just first aid and that as your go-to resource, and you can even revise the first and second prof subjects in just like this. Those 500, 600 pages have everything. For the remaining subject, use your notes, obviously. Basically plan it in such a way that this first aid actually 150 pages per day, 500 pages in 3 days you can actually revise, and the major subjects you can actually revise it over the next 4 days. These 4 subjects, this strategy, if you're actually able to revise the entire syllabus in the last 1 week, and able to retain whatever information is and able to vomit it out, will make sure that you get a good rank. Now as far as revision is concerned, since you will be lacking on time, I'll say for the average subjects, notes and practicing QBank is the best option. For those subjects which you think you're excellent at, or you think you're really bad at, you don't have any idea about these subjects, I'll say use the retrograde method. I've explained this method in another video. I'll give the link link in the description or in the pinned comment. You can use a retrograde method. What is this retrograde method? This retrograde method essentially involves that you just solve the QBank and read about theory of those papers. That's about it. You don't go any further. So it ensures that you do not get previous year question wrong, and it ensures that you have like just this much theory, that if something is similar is asked, you're able to answer. This will ensure at least you get 50 to 60% marks correct even in those questions. For the good subjects you're excellent at or good at, this also ensures that you're able to revise in a faster method. You are not wasting your time, just keep on doing the notes again and again. It is just for the average subjects you have to do first your notes, then the QBank. Okay, so let's say you have like 17 subjects to prepare, 16 to 17 subjects to prepare. Reason I'm saying 16 to 17 subjects is because I'm not considering radiology and to a certain extent anesthesia as a subject. Anesthesia is mostly pharmacology. If you do, it's mostly done. But for the remaining 5 subjects, 15 subjects, so let's say 5 are good, 5 are bad, and 5 are average. For the average one, you have to follow this, notes and QBank. For the rest, you can actually use this retrograde strategy, that you first just do the QBank and move ahead. Do the theory related to that and you move ahead. Okay, I've already made a video related to this, how to crack NEET PG in next 3 months, back in December when the exam was scheduled to happen in March. You can watch that as well. It's something similar only, but this time I'm making it very specifically for the May exam. All the best. I think you all have the capacity to get a top 100, if not top 100, definitely a top 500 rank, and get whatever the dream branch that you aspire for. Thank you and have a nice day.